Dentistry has so much to do with your health. Let us help you with that. The mouth has a huge part to play in the way that the body works. It's what everything comes in through. Air comes in through here, food comes in through here. So the mouth has a huge part to play, but the mouth also can show us so many things.
Hello, everybody, and welcome to another episode of the Raving Patients Podcast. As you know, I'm your host, Dr. Len Tao. I hope you're having an awesome time. Hope you're enjoying this time of year as you're listening to my episode. Today's episode is called How Health-Based Dentistry Can Grow Your Practice. Now, usually, as most of you know, I interview people who I've met, who I've interacted with, who I know in the industry. I meet at conferences. And this was an entirely different situation. I actually got an email from someone who works with this speaker, asking me if I'd be interested in interviewing her on my podcast. And I saw some things I thought would be really relevant to the podcast. So I said, sure, let's have her on. And this is what we're doing today. So if you are listening to an episode and you want to be part of my podcast and you want to be a guest on my podcast and you don't know who I am, just reach out. Len at drlentao.com is the email. Reach out and let me know that you want to be interviewed. And more often than not, I will say, sure, let's do an interview together. So today's guest is Dr. Michelle Jorgensen. And again, the topic is how health-based dentistry can grow your practice. So please welcome to the Raving Patients Podcast, Dr. Michelle Jorgensen. Michelle, thank you so much for joining me today.
Thank you for allowing me to be on, especially since I was a cold call for you.
That's what it was. I didn't want to call it that, but that's what it was. It was a cold email that I received from someone who you work with. And like I said, I more often than not, I'm going to at least engage, find out how they can be advantageous to my audience. And I thought it was a good fit. And that here we are now recording this episode. And it was great how responsive you were to what I needed. So that was really great. I really appreciate it.
Thank you.
So before we jump into this, and there's some really interesting topics here that I want everybody to listen to in just a couple of minutes that we did prior to recording, I really feel there's going to be some really great information to be provided. Let me read Michelle's bio so everybody knows who she is and what she does. So Michelle Jorgensen is an author, speaker, health-based dentist, and health and wellness provider. She's the author of 5 books, including Healthy Mouth, Healthy You, Holistic Dental Guide. After practicing dentistry for 10 years, Michelle became very sick. Through her own journey to return to health, she discovered the health-based dentistry field. She has created Total Care Dental and Wellness Way, a patient care-centric, health-focused method for treating dental and overall health. She trains dentists these science and research-based methods through a Total Care Academy and teaches the public through her growing platform called Living Well with Dr. Michelle. She has received certifications as a therapeutic nutritional counselor, a certified nutritional autoimmune specialist, and is a board-certified traditional naturopath. She runs an education center and started the Living Well Today Foundation that provides education and resources for people to grow their own food. A frequent and popular guest on podcasts, she loves to share her story and help more people. So that was a great bio, a lot of information we provided to those that are both listening and watching. But let's jump right in. So why don't you kind of tell your story, how you got into this space. It's really interesting, and what you really are looking to gain from being on this podcast.
Yeah, and really for me, I'm not looking to gain anything. I'm looking to share. So it was an interesting story that I think a lot of your listeners are probably going to have some similarities with. I was practicing general dentist. Things were going really well. I was actually practicing with my father, who's a dentist as well. And he's still practicing in his 70s. And I thought that that's just how it went. You just continue to learn and do better and go to continuing education, and you just keep serving patients. So that's what I was doing. I was really into and loved cosmetic dentistry, high touch dentistry, a lot of things that were helping to grow our practice. Unfortunately, I was feeling terrible. And my big things were gut issues, but honestly, it seems like everybody today has gut problems. So that wasn't that unique. But then my big ones were my memory was shot. I just, people describe it as kind of this mush in the head, brain fog, all those words. That was definitely where I was at, but even worse. I'd always had a really great memory, and I couldn't remember a patient's name from room to room. So I knew something was drastically wrong. But my big one was numbness. I had such numbness in my hands. It would wake me up all night long. I couldn't blow dry my hair. I couldn't brush my teeth because my hand would just completely go numb while I was doing it. But I also was losing dexterity. I couldn't change the burrs in my hand pieces anymore. I would have to stop after drilling out, after drilling for 5 minutes, I'd have to stop and shake my hand and try to get it to come back to life enough. And it wasn't just numb, it was painful. So these were some real bad signs. So I went to everywhere, every doctor. I was seeing chiropractors numerous times a week, massage like 3 times a week. I mean, trying to do everything I possibly could to continue practicing. And it got to the point where I actually put my practice for sale because I thought, if I can't even hold my handpiece, how am I doing my job? This isn't fair to my patients. So I put the practice for sale. And that's when I started studying nutrition and all of these things in hopes of helping myself. But I thought, well, maybe that's my next career. So I started reaching out to some doctors who had nutritionists and were doing nutritional counseling and things in their practice and saying, well, what does this look like? Could I do this? And one of them finally, just off the, totally out of context, he said, well, you sound a little like me. Have you looked into mercury poisoning at all? And I said, well, I don't have any amalgam fillings. That's not my issue. And he said, oh, no, it's not the ones you have. It's the ones you've been drilling out for a decade with no protection. Now, I had never heard a word about this. You probably hadn't either. Most of your listeners probably have not either. That mercury that's in the amalgam, and we know that. We all went to dental school. We learned, we had dental materials. We maybe slept through some of it, but, we learned that there was mercury in those fillings. When it's drilled on, it releases the vapors. And where is our head? Directly over them. So of course we are way more at risk for this than anybody else because our heads are right there. So here I was filling my brain and everything full mercury. Well, I didn't know if it was that or not, but I thought, well, I have nothing to lose right now because I have everything to lose if I can't get better. I was literally, in my mid 30s. This is the support for my family. My husband was working for the practice as well. 4 young kids. We didn't know what we were going to do. We were in a bad place. So I got tested and that's what it was. Mercury toxicity off the charts. Now, all of a sudden, all the symptoms made sense because mercury is a neurotoxin. So it affects your brain. It affects your nerves, my hands, all this stuff, and it affects your gut. So the doctor said, all right, I can help you. Now that we figured out what this is, I can help you, but you can't keep putting it in if you expect to get it out. That doesn't work. You gotta empty the bucket, but not keep filling it. So I had to find out, was there a way to do this, to keep being a dentist and not put mercury back in? I found an organization that did this. They already have protocol set up for this. And the funny thing is we think of them, I had always thought of them as the crazy people. Oh, those are the crazy people over there, and the dental school talk, at least dental school talk for me, 30 years ago was, if you do this and you tell anybody that it could be affecting their health, you're going to lose your license, right? That's what I learned. We learned about Hal Huggins and that he lost his license because he was telling people about these fillings. And so I didn't want to touch it with a 10-foot pole, but I thought, well, it's this or I have to stop practicing. So I started using these protocols. We started doing things where I was wearing a different filtration mask. I was protecting myself and the patients started paying attention. Obviously, they're like, wow, last time I came in, you didn't look like that. What's going on? So I started explaining what I was doing and telling them, this is for me. It's also for you. It's also for my receptionist and my front desk person, my assistant, my hygienist, everybody who's breathing the same air through our HVAC system here. It's for all of us. And the patients were really receptive. They said, well, we're glad that you're doing this. Thank you. And, my doctor might be interested. So they started hooking me up with doctors. And the doctors, interestingly enough, knew way more about this than I did. They started educating me. They started telling me, oh yeah, we see mercury problems all the time. I don't know why you dentists don't think about this or talk about this to yourselves or to your patients. They started then asking me, do you do ozone? Do you have fluoride alternatives? Because they knew other things that we as dentists don't talk about. And so I'd have to start learning and researching and finding the answers to the questions they were asking me. And as that started happening, the practice started growing. We started seeing patients who were looking for this kind of care. I didn't even know it existed. I didn't know patients would be looking. And that has just totally accelerated the practice. So I've gone from myself to now I have 6 other doctors that are working with me. We have a multi-specialty clinic. We see patients from around the world. And literally right now, I am booked out until next August with new patients. So this is something that the public absolutely wants. I've gone through a massive learning curve in learning how to do it. But the great news is that some of the things that have happened from a health perspective in the last couple of years in our country have really pushed people into looking for alternative solutions or solutions that are more health focused. So I've chosen not to use the word holistic because when people say holistic, you think I'm crazy. So I actually don't use that word because if you come to my office, you're going to see I'm the most technologically advanced office you've ever walked into in your life. And I have to back everything I do with research because you're going to question it. You're going to ask me, I don't believe that. I'm going to have to be able to provide you with 10 PubMed research articles that say, oh yeah, actually, that is right. I didn't know that. I hadn't read that research before. So we are at the cutting edge of things. We aren't just, making things up and saying seances and wearing tie-dye and, burning incense in our office. That's not what we're doing here. We are actually saying dentistry has so much to do with your health. Let us help you with that. And as a practitioner, you've got to be healthy to be able to do that too. And there are a lot of sick dentists. So that's one thing I love to do as well is share what does this mean for the dentist and the dental team and how can you feel better? So that's the story in a nutshell. So much that I think your listeners would love to learn more about here.
Wow, that's really amazing. And I've never heard, you hear about patients having issues with mercury and then they want the mercury removed. But I don't know of any other dentist, and you probably do because it's your space, but I haven't heard of any other dentist who has gotten mercury toxicity from removal of amalgams. Again, the people that I know that are very much anti-amalgam, they call themselves holistic dentists. And like you said, that has the connotation that they're a little bit on the nutty side. But you're taking a little different approach on that. I have a couple of quick questions on that. So one thing is, talk to me about, I know you mentioned some of the symptoms that you had. Okay. But, people are now going to start thinking about things that they've had happen to them, from a health perspective. Can you just list out specifically after going through it once before? Can you list out some of the other, symptoms that people need to be aware of that may be, symptomatic of having toxicity from a mercury perspective?
Yeah. It's interesting because I am on a forum that's, they often term it biologic dentistry. I don't like to call it biologic dentistry because nobody knows what the heck that means. Like, what does that mean? Do you know what that means? I don't know what that means, but some practitioners, that's why I say health-based, because you can at least infer the meaning. You can go, okay, it's bad health something, So anyway, there's a biologic dental forum that I'm on, and so many ladies on there will say things like, ladies and gentlemen both will say things like, gosh, I've got mercury brain. Well, it's what you experience when you just can't come up with a thought, and you can't remember something that you used to remember. That before you used to be able to remember those patients, you'd be able to recall those patients' names. And now your assistant comes to you and goes, do you remember, such and such and such? And you're like, yeah, no, I don't, I'm sorry. Can you pull up the chart? Can you, show me something? I really don't know what it is. And you knew before you could. So it's that slow decline. And it's interesting because we as humans, we start to accommodate. And we blame it on things. I call it the name and the blame. We go, brain fog. It's because I'm getting old. We name it, we blame it, then we can excuse it. Well, guess what? No, there might be another name and blame for it. It might be mercury poisoning, and the blame is the mercury you've been breathing in for the last 15 years or whatever it is. So memory issues are huge, 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 huge for this. Numbness. Lots of doctors have numbness, and we blame it on thoracic outlet syndrome because we're sitting so bad, because of ergonomics. Those aren't bad and those aren't wrong, but I treated that for years and years and years, and it did not go away until I got the mercury out. So it's neurologic function. It's the function of things. Gut issues. So what mercury does, mercury interferes with the absorption of zinc. And zinc is the thing that's the precursor to stomach acid. So if you have too much mercury, you can't create stomach acid. So you won't digest food properly. So it's going to show up as acid reflux. It's going to show up as indigestion, as IBS. These are all name and blames that we give. This is what I have. Those are all things that could 100% be attributed to mercury issues. So when you have mercury, the stomach doesn't work right. And so now all of a sudden we have all these diets and we're changing our food and we're having all these problems. Well, most likely it's because your gut's full of mercury. So those are the big three: brain fog, numbness, or just neurologic function, things not working like they should in the body, and gut issues.
Really interesting. I don't have brain fog. I have a memory like an elephant. I remember everything. So I think I'm good there. I don't have tingling or numbness. I've never had that. Thank God. I do have gut issues. I do have some indigestion, but I have heartburn. So now it can be a couple of those. It doesn't have to be all three of them that are.
100%. Yep.
Got it.
There's something else too that's interesting about this. So there's something there. We're all made differently genetically, right? So there's actually a genetic variation called MTHFR. Some people may have heard of it. It's kind of thrown around a lot. All it is, my way of thinking and explaining it is it's the way that our body puts a UPC code on things. You know, when you go to Walmart, it's got all those UPC codes so that you can scan it and the computer in the store knows what you bought. The same thing happens when we put things in our system. We put UPC codes on it and the body goes, that's a mineral. Let's go plug it into this cell. That's a toxin. Let's go put that through the liver and detox it and, excrete it. So the body needs to be able to code it so it knows what to do with it. Well, there's a genetic variant called MTHFR, and that genetic variant does not allow you to code things properly. Well, research is showing 30 to 40% of the population has this variant. I have this variant. I got one from my dad, one from my mom, which means I have both. So I'm homozygous. So my dad's fine. My mom's fine. I'm not fine because I got one of both. So I did not deal with Mercury correctly because my body couldn't put a tag on it. Didn't know that I was supposed to dump it. So it just put it in little neighborhoods. It moved it to this neighborhood and this neighborhood, and I got real sick. So that means 30 to 40% of you that are listening most likely have the same genetic variant. I bet you don't, Len. I bet you don't. Because you don't have memory issues. You may be full of, you may be able to detox the mercury better than I do. So just because I have the problem and you don't doesn't mean it doesn't exist. It means often that our bodies deal with things differently. So if you're one that's listening, that's like, wow, yeah, I have all three of the things you're listening, but you may just still have enough that it's affecting your gut. It's really interesting. Dentists need to sit up and listen to this and pay attention.
Got it. There's a lot of different hazards as being a dentist. Hearing loss and now mercury toxicity and a whole bunch of other things. Radiation, correct? Radiation. Yeah. Interesting. That's really interesting. So I want to switch gears because I want to make sure we have enough time to get to, what we want to talk about. Yes, your bio is great. Your history is great. How you've gone from one to another is really interesting. But I want to really, talk about what we're here to talk about, which is, health-based dentistry. So I know you said you holistic dentistry, biological dentistry. And you said holistic dentistry. You're not biological dentistry. You don't know what that is. So let's focus on what you've termed health-based dentistry. Can you talk about what that is?
So what that means is when you come as a patient, we say, all right, you have this tooth decay. You have this gum disease. You have dental problems that we already look at. And that's what the dentists look at, right? That's what you all look at. Well, then I also ask more questions and we say, okay, what else is going on with you physiologically? Do you have autoimmune disease? Are you struggling to sleep? Do you clench and grind? Do you have high blood pressure? Do you have thyroid issues? And we say, is there something in your mouth that actually could be contributing to the other pieces? So we just realize that you're all one body, head to toe, and that the mouth is super cool. Can I just tell you how cool we are as dental practitioners for 3 different reasons. Number one, the mouth has a huge part to play in the way that the body works. It's what everything comes in through. Air comes in through here. Food comes in through here. This is how we enter the body with everything. So the mouth has a huge part to play, but the mouth also can show us so many things. When you're getting class 5 decay, it's usually an indication of gut absorption issues. Did you know that? So now when you're seeing class 5 decay, you can ask somebody and say, do you have gut issues? And they're going to think you are so smart because they'll be like, what? How did you know? Well, I'm seeing that class 5 decay. And what it means is this. So we're relating what we're seeing. Tongue. I mean, have you ever seen those crazy talk tongues? They're like hairy or fissured or there's geographic everywhere. That's signs of something happening in the body. Just a little bit of knowledge helps you be able to help them with so much else. So that's the second reason that it's so cool. And the third reason is it's so cool is that they see us more frequently than any other practitioner. Right? I mean, how often do you see your doctor? Do you see your doctor twice a year, whether you need him or not? No. No, we go to the doctor as infrequently as possible, right?
Right, of course.
But they see us. Whether they need us or not, they see us. How cool is that? We're literally the frontline healthcare practitioners because they see us more than anyone else. Whether they need us or not, they come. So we have such potential to help people, and it's just putting the pieces together. People always now get overwhelmed and say, well, I don't know any of that kind of stuff. Well, that's why we start where we start. Basically, we start, and that may be your next question. Where do you start with this, right? So we start where you already are. And I always start with the mercury piece. I say, are you already drilling out fillings? Yeah. I'm betting most every person listening to this is already drilling out fillings, right?
Yep.
Well, how about you just talk about those fillings, not just from a, hey, this is going to crack your teeth aspect, which is, I know that talk very well. But did you also know mercury's neurotoxic? We can say these things without losing our license because that's proven. Mercury is a neurotoxin. Proven. Mercury is released from these fillings 24/7. Proven. I'm not going to lose my license to tell you that. Mercury vapor does cause issues in the system. Proven. You can say all these things. You can say, you know what? What's really great? When we remove these fillings, we're going to do it safely. For literally $1,200, you can get the equipment necessary to be able to do these mercury filling removals safely. Now you can start advertising it. Now you're the patient. You're the place that these doctors start sending their patients to. Now you're the place that they talk about on these Facebook groups because you're doing this the right way and they're talking about it. Whether dentists are talking about it or not, they're talking about it. That's the thing that I really like to reinforce to people is become part of the conversation. All of these Facebook groups, these mommy groups, everybody, they're all saying, hey, did you know mercury is really bad for you? Do you know of any dentist that does this safely? Be the person they talk about.
I see that a lot in South Florida where I live. I see that a lot in groups asking for, do you know a homeopathic or a holistic or a naturopathic dentist? And there's not a lot in this area anyway.
There's not a lot anywhere.
Yeah. So, and that's part of the reason why that you are booked out till August with new patients because there are not a lot of people who do this.
Yeah. And people who are listening, we're recording this in November.
Correct.
Okay. So that means I'm booked out 10 months for new patients.
Correct.
That's not okay. You all need to start helping me.
So I'm curious, obviously someone who is considered a holistic dentist or a biologic dentist or naturopathic dentist, however you want to put it in, it's just more of a title you're giving it. You're also then, metal free completely. You're doing only zirconian crowns or no metal in anything.
Correct. I would say 98% metal free. On a rare occasion, we need to place a titanium implant, and it's usually in a removable partial or a removable denture situation that we need to do locator attachments on. And there just isn't a ceramic version of that. So 98% metal free.
And normally you're placing, and I think you just said it, my next question was on implants. You're placing ceramic implants.
Correct.
98% of the time.
Yep. Correct. Yep. We have a periodontist, full-time periodontist on our team. And 98% of the time, he's placing zirconia. Correct.
Is he using Swiss Dental?
He's using a couple versions. Swiss Dental Health, Swiss BioHealth. Nobel has a nice version of one. Those are our two favorites. Neodent has a decent one as well. So sometimes there's different ones that work in different indications, different situations, like every other implant system.
I've gone to a couple of Swiss Dental meetings, and I've spoken at them, and that's why I've met a lot of again, they call them biologic, naturopathic, holistic. It's very interesting, the terms. So this falls into that same category, and that's what I wanted to confirm. Got it. So you mentioned an investment of $1,200. You could start doing these. So can you talk about from the business perspective, like what's required? What do you need to be able to do this?
Yeah. So you don't need very much at all. In fact, COVID helped us because remember those big vacuums that everybody bought because they're sucking away all the germs? Well, you need one of those. So great. Keep the COVID vacuum. That's honestly the biggest expense that you need is that vacuum. You're going to put that at the base of the chin. There's an organization called IAOMT. So IAOMT, you can put this in show notes. That is an organization that's already created a protocol for this. Don't try and make it up on your own. Just go on their website. You're going to see it's called SMART certification. It stands for Safe Mercury Amalgam Technique Removal Technique. SMART Mercury or SMART certification. Do you need to be certified? I would try for the certification or I would work toward it, but you don't need to be certified to start. Just start. So they're going to tell you, you need the vacuum. You need the things you already have. You need a rubber dam. You need a high-speed suction. You need a low-speed suction. You need stuff you already have. You do add a face covering. We use a nitrous nose, so you already have that too. You're going to use a face covering. You're going to use a body covering for them. On IAOMT, they have sourcing for all of that, or on my website, I do as well. You also are going to need a special mercury filtration mask for you. Now, I started using those crazy talk ones that have like these big things that sit out here. It was so hard. Like, you're trying to like balance your loops and you're trying to have these things. And then you like are supposed to look at and see something. It was so impossible. So we found a much closer fitting mask. It goes over a regular mask and it just has a higher filtration rate for mercury. So it covers your nose. It covers your mouth. You're going to make sure you've got eye covering for you and your team. You're going to make sure you have a lab jacket on that goes, to your wrists and your hands so that you just don't want a skin exposure or you don't want to breathe it in. But honestly, the vacuums are the big piece. There's a couple of things you can add for the patient on the back end. A rinse of chlorella. Basically, it's going to just bind any mercury that, you know what I'm talking about. Like you look in their mouth, you're like, oh, there's those little black things hanging out underneath their tongue. It's going to help bind that and they're going to spit it out. So you're going to add a couple of things. Again, don't make this up. Don't reinvent the wheel on this. Just go to IAOMT. Literally $1,200 or less. If you already have the big COVID vacuum, you already have the large majority of the expense. Just start doing it.
And just for clarification, the IAOMT stands for the International Academy of Oral Medicine and Toxicology.
Yep.
Okay. I looked it up. So I just wanted to confirm that for those that like to Google stuff. Yes. .org.
Yep. Check it out. And they have, if you want to know about research, like published research that can stand on its own 2 feet, they have about 10,000 resource articles on that website. Don't go researching your stuff until you get on there, because you'll be able to pull up their entire huge resource deck that has all of these articles on there. Let them do the work for you. They've already done it.
Got it. So that's where you start. Now, how do you, I don't want to say market, but how do you kind of bring it up or attract patients? How do you build your practice because of this?
Yeah, you can say market. I don't have a problem with that at all. We talk about marketing all the time. So you need to join the conversation. You need to join the health conversation. So where are those health conversations happening? They're happening on social media. So just be a part of it. Just tag, hey, everybody, we are now going to be doing, safe mercury removal. It's so great. If you have any issues with brain fog or some of these other concerns, mercury has been proven to be a part of that. If you'd like to know more, let us know. Send it off on Facebook, send it off on Instagram, whatever it is. Tag yourself with Mercury Safe. There's a difference between mercury free and mercury safe. Mercury free just means you're not placing it. Mercury safe means you safely remove it. You want to be mercury safe, not just mercury free. Most everybody is mercury free anymore, but mercury safe is different. Then you just start jumping on it. Your team member who's the one that's sneaking onto Facebook or Instagram while they're working and they're not supposed to be. That's the one you want to have do this because they know what they're doing. They can get on those groups. They can be members of those groups and they can just tag, hey, I work in an office that does this. It's super cool. You ought to look into it. Just real low key marketing. Just join the conversation. If you have doctors in your area at all, if you have naturopaths, wellness centers, chiropractors that are doing any kind of nutritional counseling, they are looking for you. So you send, again, your chattiest person over to their office and say, hey, do you guys tell people about mercury? Because did you know we're doing this? Take them something good. Don't take them a box of donuts. If you take them a box of donuts, it means you don't get them. Just so you know, you don't get them if you bring them donuts. Bring them something a lot healthier than that. When people bring me donuts, I'm like, seriously. Anyway, so bring them something, but not donuts, and say, we would love to help your patients. You're going to have a flood of patients, more than you could probably even imagine if you just reach out to a few of those practitioners.
So this is interesting because it's kind of, you don't, unless you're in these groups, you don't see the passion that the people that are in the groups really have about being mercury free and stuff. Again, someone we'll call it mainstream dental. You don't see this, but if you go to where they already found, then they flock to you because there's not many of these providers that are able to do what they need to be done.
Correct. Yep. Correct. And the place I'm going to self promote for just a minute, but it's only because I actually want to help you. So if you go to my Living Well with Dr. Michelle site, I have a whole professionals tab on there. So it's Living Well with Dr. Michelle Professionals. I have training for all of this stuff on here, but I also have a directory. And right now I think we have like 47 doctors on the directory. I get, and I'm not exaggerating, I probably get 15 to 20 requests per day of patients saying, where can I find a doctor like you? go get on my directory. If you're doing any of this, go get on my directory because I will send you patients. In fact, there's one pretty prominent health-based dentist that's in Texas. And she started telling people, she's like, go get on our directory. Like we get like 3 to 5 patients a week from this. I charge you nothing. I charge you like $350 a year because I need somebody to like maintain my website. Just go get on there. We will send you so many patients. This is a huge movement. Join the conversation.
I like what you said there. You want to join the conversation. That's the action item. You want to join the conversation. If you're interested in this, then look, some dentists are going to listen and say that's not for me, and that's fine. I'm sure you come across it a lot. And there's others that will recognize that they have an issue. There's other that recognize that some of their patients have an issue. They can join the conversation and act upon it. So that makes total sense. We have limited time left. Is there anything else that you want to make sure the listeners and viewers are aware about, how health-based dentistry can help grow their practice?
One other thing, because there's one other conversation that's being had all over social media right now that you can join, and that's the fluoride movement. So we've always been told, right, that we as dentists, fluoride is our gold standard. We have to do fluoride. Well, I actually challenge you to look into a little bit of it because there's a lot of research about fluoride that I don't even have to get into the negative health benefits, and there are some. So I'll just tell you that there are some, you can find them. But fluoride doesn't, like a cavity is not fluoride deficiency. Cavity isn't caused because of fluoride deficiency, right?
Right.
So why are we fixing a cavity with a thing that it was never there to begin with? It doesn't make any sense. A cavity is mineral deficiency. It's minerals that have been pulled from the tooth. We know this. Then bacteria crawl in the hole. Then they dump their acid. Then they make a bigger hole. This is how a cavity forms. So what's missing? Minerals. So the conversation that's everywhere right now is about hydroxyapatite. We know what hydroxyapatite is. We learned that in dental materials. Again, this is what a tooth is made of. Well, this makes sense. That's what a cavity is. It's a deficiency of hydroxyapatite. Why not just put back what was missing? So the great news is there's some great products now that have hydroxyapatite in them. So instead of ostracizing this whole group of patients because they feel really judged, I'll just tell you that. When they come to your practices and you say, you have to have fluoride and you're crazy if you don't, here, sign this release. Sign this release saying that you have denied fluoride in my practice. Well, way to make your patient feel cool. Don't do that. You don't have to disagree with them. You can say, you know what? Absolutely. Your tooth is made of hydroxyapatite. Let's actually put some of that back in. Here's some great products that are proven to actually work. So because otherwise they're going on the internet and they're finding who knows what. That may not work. How about provide them with something that will work? So again, on my website, I have some sourcing for that hydroxyapatite products that actually work. And if you email me, if you go on there, you can message me. I will send you a recipe for a hydroxyapatite varnish that you can make as well that takes the place of fluoride varnish in your practice too. So when you get patients that are asking for this, you don't judge them. You don't push them away. You don't tell them they're crazy. You join the conversation. You say, hey, you know what? I can see some validity in that. We do have an option right here in our office for you too. So you belong here too. So hydroxyapatite is the other one I would join the conversation about.
Got it. No, that makes sense. Well, that was really informative. I want to switch to my lightning round Q&A. I'm going to ask you some questions. Again, the rule of thumb here is to answer them as quickly as possible. You don't have to go into long drawn out answers here. Okay. Let's try to get through a good 8 questions. So do you keep a journal and does it help you?
I don't keep a journal, but I keep a journal-like thing. So I have a task bar on the side of my email. That is my live and die. And I have a Google Doc that I dump. Well, I do 2 things. I have a Google Doc that I dump things in, but what I dump is transcripts. So this is my absolute key to life is I use rev.com. And when something comes to me that I want to remember, or if I just have musings that I want to actually record and keep, I voice transcribe them. I just talk them into Rev. Sometimes I'll do this in my bed. I'll lay down for 10 minutes and I'll just talk what's in my head right now. And that transcribes, I pull that transcription and I dump it into a Google Doc.
And you said rev.com?
Rev.com. Live and die by this. This is what I do all my transcriptions at work as well. I walk out of a new patient appointment that's super complex. I pull out my phone. I transcribe it. Boom. I don't have to remember that patient again.
Got it. Okay. What methods do you use to keep focused?
So keeping focused is difficult because my brain runs at about 10 million miles an hour all the time. So I have had to dedicate specific time for specific things. For example, I only do patient care things on Wednesday, period. So if any patient care question comes up, they know that I will not answer them until Wednesday. If they need an answer sooner, they've got to ask somebody else. So I have really segmented my time so that I only focus on one thing at one time. Otherwise, I just don't get anything done.
Okay. Which 3 adjectives describe your strengths?
Creative, quick decisions, whatever, that's not really an adjective, but we'll call it the decisive. Decisive and infectious.
Okay. And I got that from that. You're definitely infectious. So if you had a chance to start over again, what would you do differently?
I don't think I would do it differently because the journey made me who I am today. If I hadn't had that journey, I wouldn't be where I was today. So I wouldn't do it differently.
All right. Who would you love to collaborate with and what would you love to collaborate on?
I joke that I want to be a combination between Dr. Oz and Martha Stewart. So I would love to collaborate with both of them.
Okay. All right. Let's see what else we got here. When you were a kid, what was the first thing you wanted to be when you grew up?
I went and I asked every single doctor and every single dentist that I knew if I should be a doctor or a dentist. And all the doctors said be a dentist and all the dentists said be a dentist.
Interesting. Okay. How do you define success?
Success for me is helping more people. So whatever that looks like. And what I typically find is money is the result of care. Money is the result of helping people. So if I help more people, then usually the money will follow. But the focus is the care and the focus is the help.
Got it. If you had this is a tough one. If you had a lemonade stand, what would you call it?
Living Well with Dr. Michelle Lemonade, of course.
That works. That works.
Of course. Come on.
What have you read online recently that has inspired you?
Well, I'm not going to say online because this is a book that everybody needs to read. It's called 10X is Easier Than 2X by Ben Hardy and Dan Sullivan. And it really helps you say, all right, if I really am interested in 10X, I have to get rid of like 90% of what I do. And it gives you permission to do it.
Got it. And then 2 questions left. What mindsets have helped make you successful?
Abundance. So I don't work in a scarcity mindset at all. There is enough. There are enough patients. There is enough treatment. There is enough money. There is enough information in the world for everybody and more. So abundance for sure. And I think also a mindset of leadership versus, I'm a leader versus a doer. So I am a master delegator because if I'm not, I cannot do nearly what I do. So I let other people shine where they shine and it's okay because there's plenty left for me to shine too.
That's great. And last question, and this could be either business or personal. Doesn't have to be personal only. What is one subscription that you cannot live without?
I don't have very many subscriptions, but one that I absolutely love is to Tea Runners. tearunners.com. So I get some herbal teas every single month and I just
like a box.
Put them up. Yep.
Yep. That's good.
Love it.
That's a unique one. I haven't heard that one before. That's great. So, Michelle, what are ways people can contact you, find out more, join your list and stuff? What's ways to contact you? How do they get more information?
Yep. Please, everybody, just go to livingwellwithdrmichelle.com. Click on professionals tab. You'll see all sorts of things on there. And please sign up for the newsletter. We have a newsletter that comes out a couple times a month with all sorts of new cool information, product information, all sorts of things you want. And if you want to check out what our dental practice looks like, it's called Total Care Dental. So totalcaredental.com. Check that out as well. And we're on all social platforms. So Instagram, Facebook, TikTok, YouTube. If you want to know about a lot of this stuff, just go watch my YouTube videos because there's so much on there. You can see if I'm crazy or if you actually look at it and go, maybe some of that makes sense. Go check it out.
Well, that was great. This was very informative. We went a little long, but it was good content, so I don't mind going along every so often. But guys, if you like this episode, please share it. Please let your colleagues know. Reach out to Michelle if you have any questions about her entire movement she's a part of. Join the conversation, as Michelle says. Again, let everybody know, review us, like the podcast, help promote it as well. I do want to thank the sponsors, both Dental Intelligence and the Doc Sites, for their support. And as I end all my webinars, podcasts especially, remember, your reputation matters. Until the next episode, Michelle, thank you so much for joining me, and we'll talk to everyone soon.
Thank you.